I know you've heard the idea, integrative addiction care improves outcomes, but what you might not hear as often is exactly how to make it work in the messy, unpredictable reality of clinical practice. I'm Dr. Arwen Podesta. I help addiction professionals improve patient engagement and recovery outcomes using integrative, evidence-based strategies. The first thing I want you to know is this: if a holistic integrative protocol isn't embedded into your existing workflow from day one, it will not survive. And that's what we're going to talk about today: how to take these strategies out of the someday pile, the I wish pile, and make them part of the daily fabric of treatment. The truth is, most clinicians I talk to already believe in the value of integrative care. They already want to provide it for their patients. They've read the studies, they've heard the conference presentations. They generally want to bring these strategies into their practices. But here's the problem. When the shift from theory to practice begins, something can get lost, right? Protocols that look really good on paper feel clunky in a busy clinic. The lab orders pile up, and it's never quite turning into clear treatment planning. And those mindfulness or nutrition programs, they just get pushed to the side because everyone's too busy, or maybe they're not really sure how to fit them into the existing workflow. And then patient expectations are lost, and so they aren't familiar with the plan. That happens because the system itself isn't really set up to support sustainable change. You've got competing priorities. You've got multiple disciplines working in parallel instead of in sync. And patients need immediate, tangible help, not another handout or another vague recommendation. So what happens? Integrative care ends up kind of just put back on a shelf in the back pocket. It's not there. It becomes this great idea that you believe in, but you never fully implement. And the real cost of that isn't just wasted effort. It's missed opportunities for your patients to engage more deeply, recover more fully, thrive, and avoid preventable relapses. In a moment, I'll share the exact framework I use to help treatment centers avoid the drop-off entirely. But first, I want you to picture what this struggle actually looks like in a real-world setting. Imagine you're in your clinic on a Monday morning. A new patient walks in for an intake. 38-year-old man, early recovery, motivated but just exhausted, wiped out. He's filling out standard forms. You're already thinking ahead. You want to run some baseline labs. You want to screen for nutritional deficiencies. You want to get a better picture of his sleep and his stress patterns. You know these insights could certainly transform his treatment plan overall. But what happens instead is you order the stuff, the labs, etc. The results come back a week or two later, sit in his chart. There's no handoff to the rest of the team. You may have a nutritionist, but that nutritionist might not see the patient until week 3 or week 4, by which time he's already disengaging. The counselor that he's been seeing since the get-go doesn't connect to the insomnia that you've uncovered and doesn't get that insomnia might be related to a cortisol imbalance that you uncovered in his labs, because that conversation never makes it to the treatment team meeting. And slowly, those little integrative pieces that are so profound for wellness and a long-term thriving, the very ones that could get him engaged or keep him engaged, they slip through the cracks. Now, fast forward 3 months later, and that same patient relapses. And yes, I always say relapse is part of the disease, so you need to expect it. We need to expect it. Really, we need to prepare for it. But also, relapse is complex. It's multifactorial. In the back of your mind, you can't help wonder if we had made these integrative steps part of his daily treatment from the get-go, woven it right into the counseling team meetings, woven it right into the medical visit, the team communication, would the outcome have been different? And that's the reality I see play out over and over. The good news is, there is a way to prevent it, and it starts with a shift in how we think about integrating these tools into the workflow. And here's the key insight. Integrative addiction care, it doesn't fail because the strategies don't work. It fails because of the way we try to implement them doesn't match the pace, the pressure, the need, and the structure of the real-world clinical practice. When I walk into a treatment center, I don't start with a menu of 20 holistic interventions. I start with one simple question: how can we make this fit in so naturally into the workflow so it becomes automatic? Because when integrative steps are baked into what the team is already doing, when they're not extra, but essential, that's when they stick. It starts with precision. The most effective integrative care isn't about throwing everything at the wall. It's about targeting precise interventions, individualized interventions that are guided by real data. Running a full lab panel is great, but unless you're clear on what results you're going to act on immediately, like identifying nutrient deficiencies that could be contributing to mood instability, it's just research. It's just in a paper file doing nothing. The second piece is team adoption. If the clinician, the prescriber knows the plan, but the counselor doesn't, or the nutritionist isn't making changes that the rest of the team never sees, patients get mixed messages. But when every member of the team knows exactly how their role supports the integrative step, the patient experience is a unified, reinforced part of the care, not a random add-on. And finally, it's about creating systems that make those steps sustainable, because enthusiasm is high in the first week. But by week 6, if there's no structure, no repeatable framework to keep those interventions alive, that enthusiasm fades. And when that fades, so does the patient's engagement. So if you've ever wondered why your integrative strategies don't get the traction they should, it's not because your team or you aren't skilled enough or don't know enough. It's because they've been set up like optional add-ons, like extras, instead of a non-negotiable part of the treatment plan. The solution isn't more theory. It's a process you can start applying right now. So how do you take all of this, the targeted interventions, the team adoption, the sustainability, and actually make it work in your own practice starting now? The answer isn't complicated. I boiled it down to 3 simple steps that any clinic, whether large or small, can start using immediately. As I walk you through these, I want you to think about how they could fit into your current workflow. And if you're ready to go deeper and actually build these strategies into a sustainable step-by-step system for your own practice, I cover it all in my Addiction Care Reimagined Masterclass. You can find the link in the description. I'm going to share frameworks and protocols I use to increase engagement, improve outcomes, and reduce relapse rates. Now let's get back to it. For starters, step 1 is to start with a single lab-driven protocol. Choose one area where objective data can guide your care. Maybe you decide to focus on metabolic health, ordering the labs, reviewing them with the patient in session, and connecting the results directly to nutrition or behavioral interventions. Keeping it to one targeted focus at first makes it easier for you and your team to adopt and your patient to understand. Step 2 is to integrate this protocol into the appointments you already have. Let's not create extra layers of scheduling or paperwork that will collapse under pressure in a busy clinic. Instead, embed these interventions into your existing counseling sessions or medical check-ins so they become part of the normal rhythm of care. Step 3 is to create a shared checklist for your team. This might sound simple, but it really is the glue that holds everything together. A clear, role-specific checklist means everyone from intake to discharge knows exactly when and how to apply that integrative step. It also makes it easy to spot if something's slipping through the cracks before that impacts the patient. So when you do these 3 things, target one protocol, embed it into the schedule, and make it visible to the whole team, you take integrative care out of the realm of theory and into something alive in your daily practice. When you simplify structure and assign these integrative steps, what you stop fighting against is your own workflow, and you start seeing consistent and measurable improvements in patient engagement and recovery. So it's not about doing more, it's about doing the right things efficiently in a way that everyone on your team can actually sustain it. So here's the main takeaways. Integrative addiction care only works when it's woven into the daily fabric of treatment. When every team member knows their role, when interventions are tied to clear data, when the process repeats itself without relying on extra efforts or perfect circumstances, that's when you see the kind of long-lasting results we all want for our patients. If you're ready to take this further, the next piece of the puzzle in my next video, I explain the role serotonin plays in recovery and how it works with it, not against it. Click right here to watch it next. You'll see how this one neurotransmitter can influence mood stability, cravings, and overall treatment success. Thank you so much for the work that you do every day, for your commitment to helping patients heal, and for striving to make your practice stronger. I'll see you in the next video.